Hello, everyone. My name is Dr. Jennifer Tanner. I am the founder of Runwell, and today we have a very special guest. It's Dr. Emily Splichal. Dr. Emily Splichal is the CEO and founder of the Evidence-Based Fitness Academy and Leaders in Barefoot Education. She's a podiatrist and human movement specialist, a global leader in barefoot science and rehabilitation. Dr. Splichal has developed a keen eye for movement dysfunction and neuromuscular control during gait. Originally trained as a surgeon through Beth Israel Medical Center in New York, and Mount Vernon Hospital in Mount Vernon, New York. Dr. Splichal has a deep appreciation for the role of surgical intervention as it relates to orthopedic pathologies. Welcome, Dr. Emily.
Thank you so much. It's an honor to be part of this, and hopefully we can give some good tips for the runners who are listening.
Absolutely. So, Dr. Emily, you're coming in from New York, is that correct?
Absolutely. Yep. Downtown New York.
Wonderful. And for all of you family runners out there, Dr. Splichal just had a baby.
Yes, 5 weeks ago, which is why I'm looking like a new mom.
Much appreciated. You are definitely a mompreneur. Look at that. She just had a baby and she agreed to come on this interview with us. So thank you very much. You are a superstar and much appreciated. Today, we're going to be talking a little bit about foot strengthening, the foot to core training, and some pre-activation training. So to get started, Dr. Emily, tell us why is the foot so important?
So the foot is very powerfully connected into the rest of the body from both a biomechanical perspective, but also a sensory/fascial perspective. I think a lot of the listeners are probably familiar with flat feet, high arches, and how you can make footwear or running footwear decisions based off of a foot type. Those are powerful biomechanical connections. Where I like to focus my practice around is the fascial and the sensory perspective. And there's actual connections of muscles, chains of muscles that run from your feet all the way up the leg into the deep core, into your diaphragm. So it really is how your center of stabilization connects to your foundation, which is why foot strength or foot awareness is so important for runners and from a recovery or a performance perspective.
So you're saying that your foot is actually connected to your core?
100%, yes.
Okay. So not only in relation to foot injuries, but then in relation to injuries that kind of follow all the way up the chain, is that correct?
Yeah, so a way that the listeners can tie it in is, let's say if you had a baby.
And so relevant.
And your pelvic floor and your deep core muscles, they were stretched out, so they're underactive. A lot of them are not engaging as quickly as they should be. Those muscles actually connect all the way down to the feet, that I could see a new mom returning to running get plantar fasciitis, let's say.
Okay.
So that's a connection that you could make. Another one could be the way that we breathe, because our diaphragm actually connects to the deep core muscles. It's fascially connected, that if we don't breathe the right way and have a quote unquote diaphragm dysfunction, same thing, that I could see underactive glutes in a runner, which could lead to, again, Achilles tendonitis or a stress fracture. So it could be a top down, which are some of the examples that I gave, or it could be a bottom up, which means that, I can see issues in the hip, like a hip labrum tear, let's say, or runner's knee or IT band syndrome, based off of a foot type. So someone who's overpronating, has flat feet, you can see a bottom up influence.
Okay. So interesting. Now, I was listening to you on another podcast, and you had given the example with the baseball study. I don't know if you remember that. Would you be able to go through that example? It was basically somebody was doing a swing, and the swing originated in the foot.
Yes. So I think that this is, the example. There's so many examples that I give, but with the example with the baseball swing, hoping this is it, was more related to the timing of rotations. I'll just tie it in because I'm not totally sure of the study that you were referencing.
Okay.
So rotations of the foot, we have these micro movements that happen in the foot, and then those micro movements in the foot translate up into the lower leg. So kind of the song of like the foot bone connected to the leg bone, connected to the hip bone, etc. All of these influences connect all the way up. So you're able to generate a lot more power the more that you're able to tap into the feet. When I do kind of in services or with patients, I'll actually have them move their feet to feel the rotations. So if any of the listeners want to stand up and feel what the subtle movements of the foot feel like, what they can do is stand up in your shoes or barefoot. And if you roll from the outside of the foot to the inside of the foot, so essentially if you're doing this with your foot, every time that you do that, you should feel or see that your knees are knocking in or your knees are knocking out. So there's what's called a coupled motion that is happening that is driven from the ground up through subtle foot movements. For anyone who's doing it, if you roll to the outside of your foot, you'll actually feel that your knees should be pointing out. So that rotation is actually going all the way up into your hips, into your glutes. So that movement into your glutes actually creates a powerful position. And with runners and running related injuries, most of them you can tie back to glute strength, the timing of glute activation, and how long your glutes are staying engaged. So the coupled motion translates to power. So again, I can't remember the example with the baseball swing. I'm sorry. Blame it on mommy brain. But you can see in athletes that they are able to generate a lot more power when they tap into some of this foot motion. There's an exercise that I'll go into in a little bit that actually drives your foot to the outside, which is called inversion or supination. So for any of the listeners, I'm sure you've heard of supination. Inversion, supination, or rolling on the outside of the foot, which lifts your arch, all of that equals power. And that's what we want to remember, power. How can we tap into the power position of the foot? Because the power position of the foot equals strong glutes.
Okay. Yeah, you touched pretty much on what you had said before with the other podcast and the baseball study, but one of the things that I found super interesting when I was listening to you before was that before that player even takes a swing, it's their foot that's engaging before their arms are moving, and it's stabilizing the core. And basically what you said, that's where the power is driving from. And as you're talking now, I'm doing that with my feet. I'm sitting, but I can still feel my knees going in and out with each movement. So would you say that movement is basically used as a diagnostic technique to see, like, are your joints flowing appropriately? Or would you say that's an exercise that people can do to continually engage all those other accessory muscles?
I would say both. So in functional medicine or functional movement, sports performance, a lot of our assessments are actually then the technique, right? So I'm looking at, can you control the back and forth movement between inversion and eversion, or supination and pronation? So how much movement do you have? And if you don't have sufficient balance between both of these, then I can have you do certain movements that essentially bring you back and forth between it. So the assessment could be the exercise. I also do a lot of activation. So with the baseball example, even though it was an upper body exercise, or you're throwing a ball, or you're swinging a tennis racket, whatever the upper body movement could potentially be, you get a cascade of activation from the ground up that happens first. And that's through really learning and knowing how to engage your foot, which I'll go into. So I'm not leaving everyone hanging on that, on how you do that. But the faster you can pre-activate your foot, the faster your core will stabilize, the stronger your glutes will be, and that translates to lower injury risk.
Okay. And that pre-activation is the engaging the muscle basically before the movement begins.
Correct. Yes. Yes. Which happens in our core and we don't even realize it. So if you look at people who have low back pain, people who have low back pain activate their core slower than those who don't have low back pain. So if you look at the timing of, your core stabilizers before you move your arm, it actually happens before you think of moving your arm. It's almost like, how is that possible? That your body is anticipating an arm lift before you're like, oh, lift arm, pick up, cup or whatever, right? That's built off of how protective your nervous system is and how fascinating your nervous system is, that it's really one step ahead of the movement before your brain is consciously doing that movement. Might be hard for people to grasp, but just thinking of how complex and protective the nervous system is.
So would you say, is that called core sequencing then?
Yeah, so foot to core, sequencing, pre-activation training is what I want all of my patients who are runners to do, is pre-activation, which is why I'm all about getting your shoes off and training barefoot. You don't have to run barefoot. I'm not advocating that. If you want to, that's awesome. But if you train your foot barefoot before you put your shoes on, you are actually opening up all of those sensory gateways. So bring in all the information, and then let's wake up our feet, wake up our core, and then put our shoes on. Because your shoes inherently disconnect you from the ground and from sensory information.
Okay, so it's really awakening that nervous system.
100%, yes, before you start running.
Okay, so that's something that somebody could do upon waking. If they're doing an early morning run, as soon as they wake up, they'll do these core foot exercises, aliven that nervous system, and then they'll be able to get more power from their run and reduce injuries.
Yes, and the pre-activation series could be, a couple minutes, 5 minutes, like a 5-minute movement prep series is what I try to have patients do. Versus you wake up, you put on your shoes, and then you literally open the door and just run. I mean, it's your muscles are not turned on the right way. You have to do something before you start pounding the pavement.
This is brilliant. Can you unpack this a little bit more? Are you able to walk us through one of your exercises?
Yes. So the exercise that I'm going to go into is called short foot. And short foot, some people call it doming, a foot activation. It technically is short foot, which is an exercise that is essentially pushing the toes down into the ground. I can move my camera if you would like to see my foot, and I can show it. Just don't mind the background. So I'm going to show you if you can see.
Yeah, we can see your feet.
Okay, great. So when I do short foot, I always have patients do one foot at a time. The reason is that when you do both feet foot engagement and you're not used to engaging your feet, it can be very difficult to create that coordination. So I would say 1 foot at a time. So I'm going to focus on my right foot, which is the one that's forward. And I'm going to start by finding my foot tripod. So underneath the first, the fifth, the heel. Then I'm going to lift my toes, spread them out as wide as I can, and place them back down onto the ground.
When you place them on the ground, are you trying to do one toe at a time or just all 5 as a unit?
It's fine. You can just, if you want to do that, you can, but I'm just placing them down.
Okay.
I'm trying to just spread out my skin to surface contact.
Okay.
Okay. And then my knees are bent. You can't see the rest of my body, but I'm standing with my knees bent and I'm in like a split stance position.
Okay.
Now, to do short foot, all I'm doing is I'm pushing the tips of the toes down into the ground. It might be a little bit hard to tell, but the toenail or the tip of the toe is going down and my skin is turning white or blanching, so I know that I'm engaging it sufficiently.
Okay.
Okay. And then I release. So I'm going to show you from the side.
Okay.
Same
Oh, there's a friend coming to visit. Hello, little guy.
My dog is here.
Hi, dog.
Yeah, beautiful. So he's part of all the webinars. So same position. So I find the foot tripod, the heel, I lift my toes, spread them out, place them down. And now when I'm doing short foot, can you see that my arch is lifting?
Absolutely. Yeah. So a little bit of the ball of the toe is going up, the arch is elevating. Yep. You can see the blanching in that big toe there as well as it gets pressed down.
Yes, perfect. So this lifts, and then from the front again here, this is my transverse arch. That's technically going to lift as well.
Okay.
Okay. So that's the basics of short foot. And then I'm going to be tying in some videos that short foot or doing that exercise, which engages the small muscles of the foot. Mm-hmm. We technically want to time it with how we breathe,
okay,
how we engage our core. So the example would be if we're standing in a split stance position, okay, I'm going to push my toes down into the ground, exhale, and engage my deep core all at the same time.
Okay. I'm subconsciously doing it as you're talking.
No, it's great. Great. So you would want to essentially inhale, and then as you're exhaling, push your toes into the ground, keep exhaling, engage your core, your deep core, so the TVA or the transverse abdominals, the pelvic floor, and then you keep exhaling, and then you release everything, and you inhale again.
Okay.
And then you exhale, push the toes down, engage the pelvic floor, keep exhaling, toes down, and then release, inhale, and you kind of go back and forth in a rhythm. Okay. That's an initial activation.
Okay.
I then tie it into a squat, right? Okay. Or a kettlebell swing or a lunge, any, a deadlift. There's many different exercises that I will also tie in the videos, but you're essentially thinking of finding the rhythm between your breath, which is diaphragm, and pelvic floor with your feet. And anytime you engage your feet, you want to engage the deep core and you want to exhale.
Okay, so what if somebody isn't breathing during this? Is that going to ruin the whole thing, or will they have more of that kind of sympathetic, parasympathetic engagement there?
Yeah, so you could potentially, especially if you're breathing in the sympathetic, kind of a supra-diaphragmatic, stressed out upper lobe compensation. Yeah, so that type of breathing pattern, you're technically thinking the connection between the diaphragm and the deep core is not there. When you breathe that way, you don't have that connection, which is why you want to do more belly breathing, or the diaphragmatic breathing when you do your movement prep and your foot activation, this 5-minute thing I'm talking about before you go running. Make sure that you're breathing into the belly, and then when you exhale, you're pushing the toes down, you're lifting the core, and you're trying to find that rhythm. Okay. Repetitions, right? Yeah. If you do short foot and you don't tie in the breathing and the core, and you're just pushing your toes down and trying to like just activate the foot, you still could see certain injury patterns, or you could still see less efficient running techniques because you're not sequencing the chain.
Yes.
You're essentially just turning on one end of it.
Mm-hmm.
Where our body is interconnected, we need to do the whole chain.
And that's sort of what's missing when we just hop, like throw our shoes on and hop and go out for a run, right? We're missing that whole sequencing element. We're just activating certain elements of the chain.
Yes.
So bringing those, the breathing element and tying that in, it's interconnecting.
Yes.
All along that whole fascia.
Yes.
Chain. Yep.
Yep. Absolutely.
Awesome. So would you say that, you know, they should repeat this 30 times or do this for 2 minutes? Is there a magic number that you work with?
Yep. So I actually keep everything a little bit on the lower repetition side. Okay. So 5 to 8 repetitions, nothing too crazy. Because again, you're doing one foot and then the other foot. So if you're doing, 5 repetitions on your right side, inhale, exhale, you're kind of sequencing the chain, and then go to the other side, focus on the left side, 5 repetitions. And then could we bring it into a single leg squat or a single leg deadlift? And you would do 5 repetitions again, 5 on the other side. So again, it's low repetitions, 3 or 4 exercises, and then you're good. Go running.
Okay. I wish I had met you last year because I think this may have been one of my problems. I hurt my ankle last year, and I am one of those people that I just throw my shoes on and I go. And so this year I have been taking steps to not just throw my shoes on and go, but take a couple of minutes to warm up and prep and then go. But now I've got some, the set of exercises that I can actually targeted and focused kind of what I'm looking for, right? So it took me a really long time to heal from that injury, and I don't want to go through that again.
I completely understand. And runners love to run, which is why it's, kind of hard to do a whole complex, exercise or movement prep, which is why I find that this is one of the most effective and efficient ways to wake up the body so that runners can do really what they want to do is just run, right? If you wanted to train in every other way, you would. It's how can we get your body prepped the most efficiently?
Yes. Yeah, exactly. And I think, like, people, this is only going to take you a couple of minutes. We could all do this. There really is no excuse.
Exactly.
Now, I have a question for you. It's kind of off topic, but what was the last thing that made you laugh?
The last thing that made me laugh?
Yeah.
I'm in my world of my baby, so it would be my baby.
Yeah, your baby must have done something super adorable and funny.
Yes. Well, yeah, no, we were trying to make a card for my husband's birthday that was yesterday. So I got paint non-toxic paint to do the footprints and the handprints. Yeah. And of course, she's 5 weeks, so it's not working, and she's screaming, and I'm trying to make her hand, and it is all of a sudden all over her body, and her mouth, and her hand. I hope you got that on tape, because after the cleanup is done, that would probably be pretty funny. Yes, yeah. I have adorable pictures of her with red paint all over her.
Oh my gosh, that is so cute. Speaking of non-toxic paint, totally off topic as well, but we painted our children's bedrooms using a milk-based paint. Really, really cool product. There was no chemicals in it at all, and it actually is really durable. It's still in the walls.
Oh, that's fascinating. I did not know that existed.
So that definitely exists. Okay, so we kind of went over some of that foot strengthening, how that's going to affect your core, and then how important that pre-activation training is to relate to that injury risk, right? Especially if you're that person that is predisposed, or you did that little exercise that we did in the beginning. Are your knees moving in and out as they should be? If not, then maybe this is something that you need to engage in more often, or see a professional like Dr. Emily to get a further diagnostic. Maybe there's some more specific foot to core exercises that could be done. So everybody's homework is to be doing the short foot exercise 5 to 8 times per day. We're going to tie in the breathing element as well. And Dr. Emily is generously including her Run Injury Free video series. Do you want to touch on that briefly and tell us what that's about?
Absolutely. So it's a series of videos that go into the foot activation. So short foot, you'll see a video, as well as a pelvic floor activation, diaphragmatic breathing, certain releases that I like to do for runners like TFL, bottom of the foot, lower leg, so the soleus, so certain muscles I like to hit, and then the single leg foot to core exercises. So there's a bunch of videos, some other bonus ones where I talk about impact forces, shoe recommendations, so a lot of content that people can get a deeper understanding of this.
Oh yeah, the shoe recommendations would be fantastic. I get those questions all the time. Just briefly, what's your take on orthotics?
So I think that they're highly overprescribed.
Okay.
As a podiatrist saying that.
Okay.
But I truly do, they have their role. There's definitely a role in orthotics, particularly in certain foot types.
Okay.
They are overprescribed, so I try to bring in foot strengthening over using orthotics in patients when I can. And then another key thing when it does come to orthotics is orthotics for walking are very different than orthotics for running. You really don't want to overlap and use the same orthotic for running versus walking. Again, there's kind of a gray with different foot types, but generally a walking orthotic is going to be a little bit stiffer.
Okay.
Where running orthotic, you want to have some flex to it, because part of how your body stores energy when we run is that your arch has to compress. So you actually need some arch compression. If your orthotic is too stiff and it blocks all of that arch compression, your body either has to find another way to use energy and kind of the transfer of energy when you're running, which actually becomes more muscular. So you use a muscular strategy of energy versus a fascial connective tissue strategy of energy. That's the one you want to use, is you're like a rubber band, right? So you're running efficiently, it's less energy, you're like, kangaroo-ish, versus muscular, you start to stress the muscle tendon junction higher, like at a faster rate. And that's where you start to get all of these itises that we see, is because you might be running muscularly, you're working harder than you should be, you're going to fatigue faster, and just your overall efficiency is lower. So that's kind of what I would say from an orthotic perspective. Get a second opinion if you want on it. I also, in my book that's called Barefoot Strong, I teach people how to assess their own feet so that you have an idea. Do you truly have flat feet, and what does that even mean? Are you overpronating? Is it mild? Is it moderate? Is it severe? Kind of where are you on this spectrum? And I will add that I never, ever give orthotics to high arches.
Okay.
Across the board. Across the board, I do not give orthotics. And I have had quite a few patients with high arches that have orthotics from prior, practitioners. And it's not something that I believe in. I believe in much more mobilizing the foot and creating more this pre-activation sequencing than giving a rigid orthotic to a high arch that is already rigid. You start to kind of fight the way the foot and the ground want to work with each other.
It sounds like in that scenario that knees would be at risk.
Absolutely, 100%. Actually, high arch supinated cavus feet have a higher incidence of knee stress, 100%.
Okay.
The way that they relate to impact forces and energy transfer, you do have a higher rate of injury or stress to the knees.
Okay, so if your knees are starting to hurt and you're starting to get fatigued a little bit sooner, either you need to do some of these foot strengthening techniques or look at your orthotics as part of the problem if you had just gotten a pair.
It could be, yeah.
Yeah, so this Barefoot Strong book, how can people access that?
Yeah, so it's available on Amazon, iTunes. It's an ebook as well as a printed book.
Okay.
Amazon is probably the easiest to just search in Barefoot Strong,
Yep.
or you can go to barefootstrong.com, and then
Okay.
everything links from there.
Great. And if people want to reach out to you specifically, how can they find you?
Yes, so my practice website is my name. So it's Dr. Emily Splichal. Well, I'll have it tied in. And then I have an education company that's built around barefoot science, movement longevity. It's ebfaglobal.com. And there's a lot of content. It's professional to professional education. However, I do have a lot of patients, consumers, lay people, runners, athletes who do follow it, even though it is more of like a professional.
Mm-hmm.
I think it's very important for patients or athletes, runners to educate themselves and to understand their body and the terminology and the anatomy, so they can 100% go to that site as well.
Wonderful. I'm a firm believer in education, and you've just provided us with some fantastic resources. My, are you a busy lady? So thank you again for being on here. So those resources will be linked into our bonus material if anybody wants access to her run-free injury videos. And thank you very much for being on, Dr. Emily.
Of course, thank you so much, and my apologies for the guest appearance of.
Oh no, that was a joy. I love guest appearances.
Okay, there you go.
Those little furry ones, they're so cute.
Yeah.
All right, thank you, Dr. Emily.
Thank you so much.
Okay.